Mhm.
Can people talk to their pharmacist about a dietary supplement? Because, they're here in America, they're advertised on TV constantly, much like medications are. And people might want to go into a pharmacist and say, hey, is this okay for me? Should I take this? Is this really all it's cracked up to be, according to the TV commercial that I've heard or the internet ad I've seen? Is that something else that people can reach out to a pharmacist for help with?
Yeah, absolutely. And so there are pharmacists like me who know an extraordinary a lot about supplements. There are other pharmacists that they're just kind of dipping their toe in things. But I'll give you a secret in pharmacy. If a patient walks up to me and is like, "Tell me about this supplement," and I don't know anything about that supplement, guess what I do? I read the label. I read the label and I go, okay, this contains this, it contains that, it contains that. One thing that's not taught in pharmacy school that needs to be taught more often are nutrient deficiencies that happen because of meds. So, because you're taking a statin drug, it is inevitable that your CoQ10 levels are going to fall. Because you are taking metformin, it is inevitable that your B12 is going to fall. And we really need to be doing a better job on patient education because, statin medications so rapidly deplete CoQ10. Well, low CoQ10 levels are a well-known cause of muscle pain and muscle weakness, which is also a common side effect of statins. And so we get into that chicken and egg, which came first, the statin, or was it the nutrient depletion that caused the muscle pain? So, in Japan, it's actually illegal to dispense a statin medication without also a prescription of CoQ10. You have to send the patient home with it.
So, with regard to the supplements, fact or myth, drugs can interact with supplements.
Of course they can. Yeah, I mean, listen, one of my pharmacy school professors said, "You give me a drug that doesn't have any side effects, and I'll give you a drug that doesn't work." The same thing can be said for supplements. You give me a supplement with no drug interactions and no side effects, you're taking a supplement that doesn't work. So, yes, absolutely, supplements interact. Perhaps the most classic example of this is St. John's wort and birth control pills. So, birth control pills, oral contraception, when you take them, they undergo a process called enterohepatic recirculation, where the gut basically takes deactivated drug and reactivates it and throws it back into the systemic circulation. Well, St. John's wort chews up it makes your liver enzymes start working so fast and so overtime that it chews through all the drug. And so that's a really important thing to keep in mind is that's a really classic example. And we also see dramatic changes in things like breast milk output in people who are perhaps taking a fenugreek supplement. So there's not only drug supplement interactions, but there's supplement physiology interactions as well, because you're not taking the supplement because you think it does nothing. You know what I mean? You're taking the supplement because you're expecting to have results from it.
Yeah, I agree. I'm glad you brought up the St. John's wort birth control interaction. I've been talking about that for years, and I'm amazed that 99% of people have never heard of it. I believe there's maybe 3 reports of women getting pregnant while taking St. John's wort supplements.
Mhm.
And so you're reading my mind. I started smiling when you said it because you're the first person I've heard bring this up.